thousands of feet in the air with no hospital in sight and nowhere to turn? It's not something we like to think about, but sudden death on a plane can and does happen. And when it does, a very specific set of procedures kicks in. Let's walk through the timeline of what actually happens, from the moment a passenger collapses to what the crew does next, and what happens when the plane lands. Most sudden deaths on planes are due to cardiac arrest. The passenger might collapse, become unresponsive, and stop breathing. When this happens, the flight crew springs into action. First, a call is made over the PA system. If there's a doctor or medical professional on board, please identify yourself. At the same time, the cabin crew checks for signs of breathing or a pulse. All commercial flights are equipped with first aid kits, oxygen tanks, and automated external defibrillators, AEDs. CPR is started immediately if the person isn't breathing or has no pulse. If a medical professional is on board, they take the lead. If not, the crew follows emergency training and contacts ground-based medical support. While the crew works on the passenger, the pilot is informed immediately. The captain must now make a decision to either continue to the destination or divert to the nearest airport for an emergency landing. And this decision depends on several factors, such as the passenger's condition, how far they are from the nearest airport, and weather and fuel conditions. In many cases, especially if there's a chance to save the person, the plane is diverted. But if the person is confirmed dead, the situation changes. Remember that flight attendants and even doctors on board cannot legally declare someone dead. Only a licensed medical authority on the ground can do that. So even if the passenger has clearly passed, flight crew usually continues CPR and treatment until a diversion is made, or the plane reaches its destination. If CPR fails and the body shows signs of death, crew members may stop interventions. From this point, the priority shifts, keeping the cabin calm and handling the body with dignity and respect. But what do they do with the body? Planes do not have morgues, so it depends on the type of aircraft and how full the flight is. If seats are available, the body is moved to an empty row, covered with a blanket or curtain. If the flight is full, the body may be left in its original seat with passengers next to them moved if possible. The crew will also secure the body with a seatbelt for landing. They ensure the area is treated with respect and try to keep other passengers calm and unaware, especially if children are around. Crew members are trained for in-flight medical emergencies, including deaths. They follow airline protocols, but discretion plays a big part. Some airlines have additional resources, such as special kits to mask odor, curtains or screens to give privacy, and access to on-call medical consultants during flight. Meanwhile, they continue regular duties while keeping affected passengers, especially family members, supported and updated. Sometimes a crew member is assigned to stay nearby the deceased until landing. Once the plane lands, airport medical teams and law enforcement board the aircraft first. Here's what happens next. Officially pronounce the death. Remove the body respectfully, often using a stretcher. Take statements from crew and medical professionals on board secure. Any personal belongings for handover to the family. If the person was traveling with someone, that person is usually taken aside and supported through the process. Airlines also have crisis teams trained to handle grief support and logistics. Every in-flight death triggers a formal report. The airline must report the incident to aviation authorities, document the entire timeline, and file health declarations for all passengers, depending on local regulations. If the cause of death is suspicious or unclear, a post-mortem may be ordered. This happens more frequently on international flights due to jurisdictional rules. In-flight deaths are rare but not unheard of. According to studies, approximately 1 in every 600 flights involves a medical emergency. Of these, about 0.3% result in death. So while the odds are low, airlines take the possibility very seriously. Most at-risk individuals are those with underlying heart conditions, the elderly, or those with pre-existing health issues. Long flights, changes in air pressure, and dehydration can also contribute.